And I want to just kind of mention, there is not currently an outbreak in the United States, but of course, because of the outbreak in West Africa, this could also be a risk for the United States at any time, just because we have that international flight, we have missionaries and different people actually in those areas that can come back at any time. So we still want to be on guard, we still want to have this screening process in our minds, and we really want to be very vigilant in making sure that the staff understand what to look for, as well as you as a community. You want to make sure that you can protect yourself as well. So the first thing we want to do is understand what it is, how it's transmitted, and what you can do to protect yourself. So of course it actually enters through the mucous membranes. Mucous membranes are going to be any types of breaks in the skin. It could be needle sticks as well. Through your eyes, nose, or mouth, that would be your mucous membranes. It's going to start affecting many cell types. It's going to migrate through the lymph system. It's going to affect your liver, your spleen, your adrenal glands. The liver necrosis will be liver failure or some type of bleeding problem. These people are going to have multi-organ failure, possibly shock, if the disease progresses. So when you think about multi-organ failure, at that stage it's kind of hard to contain those body fluids. That's why the risk becomes a lot higher for healthcare workers at that time and other people in the community. But by then, hopefully, they're not feeling well enough that they've already checked themselves into a hospital or facility that can help them. The symptoms, of course, are going to be your fever greater than 100.4 or greater degrees Fahrenheit, a severe headache, muscle pain, weakness, diarrhea, vomiting, abdominal pain, or unexplained bleeding or bruising. Those symptoms can mimic a lot of things: malaria, other infectious diseases, the flu, stomach bug, anything. So our key point here on screening is making sure we understand where they have traveled. Have they traveled internationally? Have they traveled to those areas where they're having the outbreaks? Have they handled any of that infected meat in Africa? What were they doing? So the first thing we're going to ask you when you come to our clinics or our hospital is about where your travel. Where have you traveled, and are you having any of these symptoms? The incubation period is 2 to 21 days, and the CDC has even said that it may be longer than the 21 days. It could possibly be 31. What the incubation period is, it's kind of like you've been exposed to a virus, maybe like the flu, but you're not showing symptoms yet. Your body hadn't quite picked up on it, and then all of a sudden you start experiencing those symptoms. That can occur on average at day 8 through day 10. When you start experiencing those symptoms, that is when you are contagious. It's not like the flu where you're contagious during that incubation period, but actually before, you can't actually spread this until you show the first sign or symptom. So that's a little reassurance there. So you're not contagious until you start showing those signs and symptoms. Again, it's spread through broken skin, mucous membranes, your eyes, nose, and mouth. It's spread through blood and body fluid, and that includes, but is not limited to, your urine, your saliva, your sweat, feces, vomit, breast milk, and even semen. CDC says that it can survive several days at room temperature outside of the body, as long as it's a blood or body fluid. So it can even contaminate other things such as objects, clothing, bedding, needles, sharps, medical equipment. All those things, if they have the virus on it or blood and body fluid, it can live for several hours. And of course, those infected animals such as the bushmeat. And another thing to kind of remember too is, when we think about outbreaks in West Africa, they don't have good sanitation means over there. They don't have good running water. They practice certain rituals and cultural beliefs where they actually cleanse the body from the inside out before they prepare the human remains. So when you think about manually removing feces and undigested food, and then you don't have good sanitation means, of course it's going to, any virus or disease can spread very quickly. So again, this is not West Africa. We do have good running water. We do have good supplies as far as medical equipment, and so we can contain this a little bit better should this ever happen here.